Los Metropolitan Pandemic Task Force Daily Briefing with Dr. Alex Garza. The briefing will begin momentarily. We will take questions that have been submitted by members of the media after he makes brief remarks. I'll now turn it over to Dr. Alex Garza.
Okay, good afternoon everybody, and thank you for tuning in to today's briefing. Now, I know that the corona pandemic is one of many important stories demanding our attention this week. So I want to thank you all for taking time out of your schedule to tune in and stay informed about the state of the pandemic in our region. In Wednesday's briefing, one of the data points we shared was the percentage of frontline hospital employees who have received the COVID vaccine. And so as of now, there's roughly about half of those employees who have received vaccinations. And like any other population, we're still trying to find out why certain people have not gotten vaccinated and to get them vaccinated as quick as we can. Now we know that we still have some ways to go before we get through our frontline workers in this battle, but we believe that we've learned a lot from earlier on in our vaccinations, and we can start increasing the speed of those vaccinations. So it's not too much to be unexpected, given the enormous effort to get the entire population vaccinated in as short as time as possible. And of course, no battle plan survives first contact with the enemy. So we know it's going to take time to work through all of these different populations to get vaccinated, but we're constantly looking for ways to speed up that process and believe that we will get more people vaccinated in a faster amount of time. And so that way we can get everybody vaccinated and get back to normal as quick as we can. In the meantime, everybody can still make a difference by taking steps to stop the spread. And you can also take some time to learn about the COVID vaccines so that you'll be prepared to make an informed choice about the vaccine when it becomes available to you. For people of color in our community, making that informed choice is complicated by a long history of mistreatment and trauma at the hands of scientific and medical communities. And these issues are not only historical. Black and brown people continue to experience systemic racism and inequality when seeking health care. And this raises valid questions about how the vaccine will be distributed and administered equitably. Joining us by Skype today to discuss these concerns is Dr. Mahdi Shalashwayo Davis. Dr. Davis is an infectious disease physician at Washington University and at Barnes-Jewish Hospital Center, as well as the John Cochrane VA Medical Center. Dr. Davis, thank you so much for joining us today. And I'm going to turn.
Thank you so much for having me today. It's an honor to be here and to speak to members of our community at such an important time in our country and during this pandemic. I am a physician, and my area of specialty is in infectious diseases. So over 9 months ago, when we found coronavirus here in the US and in our communities, this is the work that I was tasked with. And I was also 7 months pregnant. I had my second child during this pandemic. And so I understand this in deeply personal ways that many people in the public have been experiencing this pandemic. What I want to say today is that I am now fully vaccinated. As of an hour ago, I received the second dose of the Pfizer vaccine. If you had asked me 6 months ago if I even thought that would be possible, I would have said absolutely not. And it's an absolute triumph of science that we are here today. But I say that understanding that this is a difficult topic for many people in our community. And when I say our community, I'm speaking specifically to Black and brown people who have a lot of mistrust in many cases around getting a vaccine and even around accessing care. And we need to be honest about why that is. And that is because of years and years, dating back to slavery, in the case of the Black community, of atrocious acts that happened within our communities where we were treated unfairly. We had, in the cases of Henrietta Lacks or the Tuskegee experiments, clear and documented cases of abuse against our communities. And this has resulted in mistrust that is valid, that is understandable. So I don't come here to tell you that you should not feel this way. I come here to humbly say, first of all, I completely understand. And quite frankly, have my own issues around mistrust with government and the scientific community, even though I'm a physician. Having said that, I trust the science. And I come to you today as a scientist, as a person who has dedicated her life to medicine and to public health, who's deeply passionate about marginalized populations and Black and Brown communities, the communities that have raised me and that support me. And because we are getting coronavirus at rates much higher than other groups, and we are dying at rates much higher than other groups, we do not have the time or the luxury to debate this. We need to look at the science. And so what I want to say is I have been looking at the science since the beginning of this. And what we know is because of research that started way before this pandemic, I know for some people, it's very worrisome that this came out so quickly, this vaccine, but a lot of this work had been done before. The family that SARS-CoV-2 comes from, the coronavirus family, is one that we've studied for many years. And it's an unprecedented time, right? This is a time where every single government, all governments across the world, and academic institutions and research institutions, pharmaceutical companies stopped what they were doing to literally focus on this. And what we have is clinical trials that have sound data and data that has been reviewed by diverse external review boards that shows that this is highly efficacious and safe. Now, we know what the documented side effects are. And what I say to you is I had to sit down and think about, for me, my family, my baby girl, Naniso, that was born in May of this year, what is the risk or benefit of me taking a vaccine versus the risk and benefit of me not only getting coronavirus, but possibly dying from contracting it. And it's clear to me that the vaccine is one of the most important tools that we have in our toolbox. That toolbox still includes masking, social distancing, not engaging in large gatherings, and hand washing. But right now, that vaccine is such an important, I would say, the central tool in that toolbox. And so I come to you today to say, this has been an incredibly difficult year. I am exhausted. This work has been hard. Losing people along the way has been taxing. But today, as someone who has received the second dose, I do have hope and an incredible amount of gratitude for the science that has brought us here. Please continue to ask questions. Go to trusted people in your communities who are doing this work, whether it's your doctors, whether it's other leaders in the community. Feel free to email or contact me and others like me. But hear me when I say that this is a time to consider this vaccine because it is literally a matter of life or death. Thank you so much for having me today.
Some of these issues, these really important issues with our audience today. So this is an important conversation that we're going to continue to have for many, many months. So now let's go and take a look at our numbers for today. So starting as we always do with our new hospital admissions, and again, these are COVID positive patients, 2 days delayed in reporting the data. Our daily admission number today is 97, and our rolling 7-day average remains very high at 98 admissions per day. So again, as you'll see, we still have a number of admissions in all of our hospitals per day. Moving on to our census numbers. Today we're reporting 767 hospitalizations with confirmed COVID positive. That compares to 805 on Wednesday. And our moving average now is at 796. So again, still high numbers of patients that are in our hospitals. A little more detail about our census numbers today. As I said, we have 767 patients currently hospitalized with COVID. Of those, 155 are in our intensive care units and 98 are on ventilators, which has stayed about the same since yesterday at around 97. Taking a look at our suspected COVID patients now. So again, these are patients that we're waiting to get a test result back from. Today we're reporting 66 patients hospitalized with presumed COVID. We have 7 suspected COVID patients in our intensive care units, and we have 4 suspected COVID patients on ventilators today. Moving on to our discharge slide. So again, our good news slide, we've discharged 126 patients yesterday. Again, large number, but we have large numbers within our hospitals. Our cumulative total is at 15,456 patients discharged. And again, a big shout out to our healthcare workers and everybody that supports them to get these patients well enough to get discharged from the hospital. Unfortunately, we continue to have deaths from coronavirus. Today we're reporting 16 deaths from 24 hours ago, and our moving 7-day average is around 20. And again, reinforcing the best way to prevent our deaths is to move the timeline backwards, to decrease our hospitalizations, to decrease our admissions. And the way to do that is to decrease cases. And the only way that we can decrease cases until we can get enough vaccine out there is to practice social distancing, wearing masks, and not gathering in groups. So today is Friday, so we'll share a little bit of our admissions data from the prior week. And again, this is data that our analytics team puts together on a weekly basis. So as you can see here, we're seeing still quite a bit of admissions from across the St. Louis metropolitan region, as well as some of those outlying counties. Now, it has come down a little bit over the preceding weeks up until this week, but still large number of admissions coming from those counties as you see here. Looking at it from a little bit larger graph, you can see again where those admission numbers are coming from. Mostly from those collar counties outside of the more urban areas. But as you can see, still a high number of admissions coming from across the metropolitan area. And again, just looking at admissions coming from the surrounding areas since September 15th, this is just rank ordering the number of patients that we've had per 100,000 from across the metropolitan area. And this is just a different graphic representation, so we're not going to go through this data today. Okay, so when we share data about how the virus is spreading among counties or age groups, it shows us that we needed to spend a little bit more time and attention to stopping the spread. But it also shows us the reality that the virus really doesn't respect age or geographic boundaries. And given the opportunity, it will or it has spread everywhere. As we know, we have a very fluid population. They move from county to county, from region to region. And this then means that we spread our risk out everywhere, our risk of getting infected and eventually turning into hospitalizations. So there's no way that we know how the virus is going to impact you or someone that you love. So that's why we all need to stay vigilant and informed while we wait for the protection of the vaccine to become more widely available. And with that, we'll take some questions from the media.
CDC is reporting that in Missouri, more than 113,000 people have received the first dose of COVID-19 vaccine, which is a little under 2% of the population. How does that number compare to expectations?
Well, certainly it's not where we would like it to be, for sure. 2% is a far cry from what we commonly say is needed for herd immunity, which is around 70%. And so, you can do the math and figure out how close we are then to getting to herd immunity. So part of that, though, is dependent upon how much vaccine you receive. And so certainly we can't go any faster than the amount of vaccine that comes into the state as well. So there's multiple different reasons why that number is not high. You got to have vaccine, and then we have to work our way through the populations. There's quite a operational challenge with getting vaccine delivered as well. So all these things contribute to not having that number higher than what we would expect it to. But The bottom line is you know, we would like it to be higher, but we also recognize that there's rate limiting steps within that process.
Are there benchmarks for how many vaccinations we should ideally be adding each day or each week?
Well, there's no real benchmarks per se. But let me put it to you in this way. So we know, you know, there's been dates that are floating around about when do we expect the entire population to be immunized. And so you can do simple math and try and figure out how many vaccinations do I need to do in order to hit X date. There's a popular sort of date that's been thrown out about July 1st. The entire population should be vaccinated. But, you know, in order to do that, we would literally have to vaccinate around 1 million people a day to get that to work out. And if you do the math, then extrapolate that down to Missouri, it would be tens of thousands of people being vaccinated every day if you wanted to get to that end result of everybody being vaccinated by July 1st. So, you know, there's no real benchmark about you want to be at this pace. Certainly you want to be using as much vaccine as you have, getting as many people immunized according to the volume that you have. But as I said, there's a lot of things that play into that, whether that is the amount of vaccine that you receive or just the operational constraints of getting people vaccinated. So it's a tough question to answer. I think the easiest answer is we want to get as many people vaccinated every day that we can so we can get closer to herd immunity.